Hello friends, today let's discuss about happy mealtime strategies in neurodiverse kids like autism and other neurodevelopmental delays. Many times you have come across the term picky eaters. So what does that mean? Actually, picky eaters are the people or the kids who have strong preferences for few food items. When your child limits himself or herself to the variety of foods, maybe because of non-acceptance to the taste, smell or texture, they have a strong preferences to eat during the meal time, to eat the food in a particular environment, in a particular utensils. You have seen that the kids with autism and other neurodevelopmental delays, they face many difficulties and challenges during their meal times. So that the cause of this could be sensory processing difficulties which they are facing, sometimes behavioral issues, sometimes oromotor difficulties also comes the cause of being a picky eater. There are sometimes some physiological changes also lead to difficulties in eating the particular or preferable food items. Sometimes speech delays also is the cause of such difficulties. So many children faces difficulties in expressing their food preferences during the meal time due to their potential speech delays or impairments. Some of the kids have sensory processing difficulty, which make it very difficult for them to process in and to respond to different sensory input or the information which are present in the environment during the meal time. For example, if any kid is hypersensitive to smell, parents may think that the child is running around and showing escaping behaviors, but that is maybe because of the new smell which is not liked by your child, and thus it's not about the texture, it's not about the taste. Sometimes they're hypersensitive to smell. In the same way, they could be hypersensitive to taste also, they could be hypersensitive to texture also. So we have to explore what is actually the cause of having negative behaviors or escaping behaviors or too much of acceptance of all kind of food. We have to explore that cause if it is related to sensory processing, because sometimes the kid shows behavior regulation issues, for example, because of their sameness. For example, to drink or eat in the same kind of a cup, a bowl or a plate on the same chair and table. And this is how sometimes many of the parents complain that we have invited the guest and the child shows lots of negative behaviors which are actually not even present during their daily routine activities whenever they are alone with the family or eating the food alone. There are sometimes some of the physiological intolerances, for example, lactose intolerance, diarrhea, constipation, they also disturb your kid a lot. Different kind of oromotor difficulties, for example, biting, chewing, swallowing, could also cause various or weird food preferences or food cause. Sometimes they are not able to sense their internal signals of fullness or hungerness because maybe of some disruptive interoceptive internal feeling sense. It happens when we expose the kid for longer duration of time on the dining table. So the kid internal feelings or the exposure to that sensory environment thinks that because I am sitting on the table and I have lots of food, so they will escape from eating. And sometimes they will think because I am on this particular environment, so I have to eat because this is a meal time and important eating time with the family, so they will not stop even though they are not hungry for any kind of eating that particular food. So my dear friends, we have to search for the solution and intervention for these mealtime challenges definitely, and no kid is same, so no same strategy or a single strategy, as we all know, with autism will work out. We have to explore, which means that every child will experience different challenges and will respond differently to different strategies, which I'm going to discuss one by one. So let's talk about food's texture. So we have to explore the sensitivities and the food texture. So we have to give different kind of texture preferences to your child, which are preferred by your child. For example, the kids with autism eat fish as they tend to lack omega-3 fatty acids, but they are not liking the visualization or the texture of that particular fish. So what we have to do to change the preferences, we can offer them different kind of fish burgers or same texture kind of a food mixing with salad or yogurt. So we have to gradually and slowly introduce the new texture food rather than giving the new texture all of the sudden. Example, gradually means like day by day. So what you can do is, for example, if you want to get introduce the banana in the meal of your child, then you can just put banana nearby to your child with some visual card. The second day, for example, Tuesday, the second day, you can just cut the banana pieces and show the card as well, so that child just pick up the card or the piece of banana. Then Wednesday, again, you can introduce the new fruit as well and show the card of the banana. Maybe the child will be more interested to respond to the card of banana rather than the new actual food items. Then Thursday, Friday, continue to introduce some of the cards and the actual food item. So out of that, your child may revisit to pick up any particular card, and then with that particular card, you can offer your child that particular food to touch, to smell, and just even if your child decide lick that particular food or bring very near to the mouth, is where you need to give praise and reward, positive reinforcement to your child, so that he will gain the familiarity of that particular food in his new experiences, and thus that new taste, new smell, new image, new color will come into the dictionary of your child. We usually uses rule of 3, that 2 preferred items, 2 food items which your child likes, and third is the non-preferred food items, so that the child will just pick and eat the preferred food items out of the 3. But you have to prompt, you have to motivate the child, again the same strategy, to touch, to smell, to visualize the image and color of the non-preferred food item. And gradually with this rule of 3, the child could be able to start smelling, licking, biting, and then swallowing the food item if he likes it. I would suggest that stop spending lots of time for the food which the child is not liking, or if the child is continuously rejecting. It would be better if you can explore the taste, texture, smell of your child and introduce based upon those preferences in the diet of your child. Create a specific routine for your child. As mentioned earlier also, that the kids with autism, they tend to show the repetitive behaviors. So rather than correcting those repetitive behaviors, removing those undesirable behaviors, it would be better for the parents that they should establish new practices, new patterns that are more beneficial. This can be accomplished by some specific place for the meal, for example, interesting, colorful, high chair or particular child size table, having the consistency in the meal time, and with positive statement, hey, let's have time to eat, or any kind of a brief song related to the meal time, so that the child will interestingly, getting transit easily into the from the previous activity into the mealtime activity. Mealtime, to having a good sitting tolerance, you should have him to eat regularly with family and with limited distractions. Do not allow your child in front of gadgets, TV, mobile. Do not allow your child to get the attention-seeking behavior specifically from mothers by roaming around your child, running around your child, making him sitting and standing while eating. So if your child is not interested to sit for 10-15 minutes, please start with small amount of time that your child is willing to stay there. This might be 5 minutes or a brief of 30 seconds also, because we have to move further from 30 seconds to 5 minutes. Slowly we can increase the amount of time at the table until you will reach to the typical meal time from 15 minutes to half an hour. So use of positive reinforcement, it is very crucial when we are introducing new food for texture, taste and smell. We can say, oh, I like that how you just tried that piece of particular broccoli or banana or salad. Whatever we as a parent liked in the behavior of our child, we should use positive praise so that it can motivate that particular behavior again to gain our positive attention. Rewarding them with extra time on activities, whatever they enjoy, any kind of a game, we can reinforce that just after the activity, we will give you that kind of a particular game on the computer. Use of positive statement by the parents are very important for the kids. For example, great job, I am impressed. Whenever even your child licks, tastes or bite a piece of new food, even though he is spitting out that, but for that particular time, you have to praise through the positive statement. Just avoid all the negative behaviors, for example, attention seeking, tantrums. Remove all your attention. Ignore means just ignore. Don't even give any kind of verbal or facial expression to any inappropriate behavior during the meal time. Structuring your mealtime helps in creating the new positive environment. You have clear expectations and boundaries from your child to get those encouragement and openness of trying the new food with new texture, taste or smell. To keep the mealtime comfortable and supportive away from distraction will really help. So keep mealtime very focused away from distraction. The child should get very supportive, comfortable, calm environment during the mealtime. Use of augmented communication devices are very helpful to express the emotion, priorities, preferences of your child, because sometimes the child is not having word to tell their own preferences. Many times parents think that if they will use augmented and alternative communication devices, the child's speech will not develop and the child will be more dependent upon the use of those devices or those different kind of cards. But it is not so. Researchers have already proved that these AAC, these communication devices really help in many positive behaviors, way of expressions, way of communication, and they help the kids to get those words when they use these AAC devices. The researchers have shown that these AAC devices never interfere with the speech, rather than increasing their ability to learn speech and ability to communicate whenever they want to communicate regarding various kind of needs, various kind of expectations they want to have around their environment. Parents can also use labeling of the items will give them the words which the child sometimes struggle, and when we label that particular item, the child gets that word, and with the practice he or she is able to communicate through the hand gestures also. For example, if the child is hungry, we can make them practice to put their hand over the tummy, or we can make them practice crossing their arms, which demonstrate that stop, I'm full. So these kind of alternative communication hand gestures also helps your child to tell their food preferences. Use of different kind of pictures of the food, selecting those food items from the pictures they like to eat. Sometimes sleep disturbances could be the cause of irritating meal time, because if the sleep is disturbed, which is very important for overall development, this could also cause irritation, gastrointestinal irritation. So establishing a good bedtime routine, like putting a comfortable bed sheet, clothes, reading of books every night before bedtime may also be one of the important crucial strategy used for the kids having various kind of eating or feeding issues. Use of positive role modeling is also important. Be a positive role model for your child, because when we introduce any kind of meal and eat with the kids and say something positive about the food, for example, a parent could say, "Oh wow, I'm liking the texture of this food in their mouth and they are really enjoying the food taste." The children tend to imitate their parents or adult around them, so it is very important to use such kind of positive behaviors for them to model. If the child has older sibling, cousin or a friend on a daily basis who could really help child to sit during the meal times to get imitation, get good mealtime behaviors through imitation, will really do wonders into their food preferences. Apart from this, we all requires lots of patience, preparation, intentionality, specifically when we consider the challenges with various routines, such as one related to eating, because searches have shown that mothers are really having high level of stress and depression when the kids faces difficulties in eating habits, and there the family, specifically father, could take over some of the responsibilities which could ease mothers or the caretaker who is responsible for mealtime, and thus it could help your child when we sit together or divide the responsibilities, so that child as well as mother or other family member or the caretaker could be more attentive, less stressful, and no depression while feeding the kid. So my dear friends, I hope that you are able to understand today's discussion about having the happy mealtime strategies with your kids, and thus we can have good happy mealtime along with the kid and family, and thus we are able to help our kid as well to be independent in choosing their food and having good food or mealtime behaviors on the table during the family mealtime. So my dear friends, if this video is helpful for you, so don't forget to hit like and subscribe button. Thank you.